So I thought for MGUS, or for the enhanced service, it might be useful for some, I'm sure, just to know roughly how that sort of thing works. So at the bottom of my each monthly thing is a folder called Supporting Searches, and in there is MGUS. So we've got our MGUS register, so this is our MGUS with no hematological malignancies. So the idea is that they might have an old MGUS and then they've actually converted to myeloma. So we're just making sure we're not picking up on those. And the question then is, how do we make sure that we're getting them in every 6 months for blood tests and yearly for an annual review? And the goal is to pick up these individuals through monitoring before they develop to the point where they've got irreversible bone damage, irreversible kidney damage, and also to be able to catch them and treat them whilst they're still fit and well enough to actually tolerate some of the more aggressive, very effective treatments. Now, this is a useful example of how the whole set of searches really work. So in MGUS, we want to have 6 monthly full blood count, UNEs, bone profile, and immunoglobulins electrophoresis. So I have folders that look for various tests at various frequencies under testing frequency. And we're looking for our 6 monthly blood tests here. So we're looking for patients who we want to make sure if they've got MGUS that they're having, for example, their full blood count 6 monthly. And what I have in here then is a search. If we edit that search, it looks for people on long-term sulfonamides or trimethoprim, and it's also now going to include patients who are on our MGUS register. And I've done the same for our 6 monthly UNEs. So on this register, it's got the list of people who have their 6 monthly thing. So that's a whole bunch with various medications who need 6 monthly. And then we've got some of our CKD rules and 6 monthly. And then we've got at the bottom here our MGUS, no hematological malignancy. And then we've done the same for our calcium 6 monthly. There won't be a lot of people calcium 6 monthly, it's just this. And we had to create a search for people who need immunoglobulin 6 monthly, which again is probably just MGUS. And when we do each of these searches, there's also another search which looks for patients who haven't had a full blood count done in the past 6 months, who haven't had calcium done. These are all then pulled into a next search up, which is these are the people who need 6 monthly bloods. So what this will look for is, say for example, you're on my full blood count 6 monthly register, you haven't had your full blood count done in the past 6 months, you're going to fall into a needs a 6 monthly blood test register. And the same for, so if I go back to that, the same for calciums, the same for immunoglobulins, and anyone who is on a 6 month register list saying we want this done 6 monthly and that test hasn't been done in the 6 months period, they fall under my needs the 6 monthly bloods. And then what we have then is also anyone who falls under frequent blood tests. So this will be your people who need something 2 monthly, 3 monthly, 6 monthly or monthly. I separate those out from the yearly bloods. That needs frequent bloods then comes into my routine monthly recalls, and they come into these two lists here. There's the shared care or the frequent but not shared care. So your shared care people are your high risk DMARD drugs. The frequent but not shared care are people like your NOAGs or some of your CKDs that need close monitoring. I've tended to rule out people that I think are under nephrology or transplant teams anyway for that. But as an aside, I know that this group of MGUS patients will now fall into frequent. The annual guys will get called in on their birth month, but these guys, the MGUSs, will get called in every 6 months. So now I know that if we're running the system, they'll get invited, and we should code to say they've been invited, so if there's no follow-up, that we then fall under lists down below to say, chase them, there's been no response, or there's been no response to 2 invites. But what's important is when they come in to see our healthcare or phlebotomist, that we know that those tests that they need are going to be put there in front of them. Now the way that works is these patients, we need to set up our templates and concepts to pick these patients up. So that means playing with concepts and templates. So when we're talking about concepts for this, there's a whole variety of concepts that templates use to look to see what tests are needed. So we create a concept for MGUS. So we say, okay, these are patients with MGUS but no hematological malignancy codes. We then say, if you've got MGUS, the same as we did for the searches, you need to be on our 6-monthly full blood count concept. And when I open up that 6-monthly concept, it has the list of medications that need 6-monthly full blood count. So trimethoprim if you're on that long term, azithromycin, teriflunomide, or MGUS. And then the same is true for 6-monthly calcium. They will be on my 6-monthly calcium register. The same is true for my UNEs. They'll be in the UNEs 6-monthly. We also had to create a new set of concepts for immunoglobulin. Now the way this works is it says people on who needs 6-monthly immunoglobulin, the MGUS people. There's another concept looking, have there been immunoglobulins done in the last 6 months? And then we have a concept that says here, right, this person needs 6-monthly immunoglobulin. They don't have anything recorded in the past 6 months. So that then creates a template, creates a concept for our template, which is needs 6-monthly immunoglobulin. If I then go back to our template, what you'll see here is I've got a HCA template, and this is the thing that opens up when you double click on HCA, and this has got a whole hundreds of different sections. Every single section is linked to a concept. So for example, there's a concept for people who need regular eye tests suggesting, depending on the medication they're on. So if I come down this list of concepts and I find the full blood count 6-monthly concept, for example, that is triggered by a concept that says needs full blood count 6-monthly. So my MGUS patient, if they haven't had a full blood count in the last 6 months, when they come and sit in front of a healthcare assistant, I know that that'll trigger that section to show, to make sure the healthcare knows to do a 6-monthly blood test. And so there's a similar section for full blood count, there's a similar section for calcium, there'll be a similar section down here for their various tests, and then if I keep going down, it'll have the immunoglobulins. So it'll say, right, this patient, this will have a concept again, it says needs 6-monthly immunoglobulin. So this is someone who has MGUS who hasn't had their immunoglobulin done. And if that's the case, it'll show that section and say, hey, consider that. Now, as an aside, I've pulled in a couple other sections, which again is perhaps, these aren't necessarily ones where I would say, please do this. This is, please consider. So this is the type of thing I'll put in if somebody has high immunoglobulins, but there's no diagnosis of MGUS and there's no diagnosis for a hematological malignancy. I might still have a little suggestion saying, this is something that's been picked up before, you might want to check it again. In case it's been missed, or perhaps somebody's thought we'll just follow this up in due course, I know that'll happen. And it's the same, so this group here, if I go to the text section on that, what I've suggested is previously slightly raised immunoglobulin. Now these are people where their IgM might be 6, but it's not over 10, so it's not hit the threshold for considering hematology diagnosis. But I'd particularly suggest checking it again if somebody does have myeloma symptoms like back or rib pain or fractures, etc. Now the other thing we need is we need our nurse template to also have a section for that annual review. So the nurse section works in the same way. Again, we've got lots and lots of sections here that'll only show if somebody needs that section. So say, for example, if somebody is in the chronic disease list or over 65 but no pneumococcal, the section will say, hey, what about a pneumococcal vaccine? And if I scroll down this long template, now it doesn't show every section, it only shows the sections relevant to that patient. But I know that down on this list is an MGUS section. I'll keep going because these things are, hang on. So what we have here then is a section where it's looking for patients who are on the MGUS but no hematological malignancies, and it's inviting our nurses then to do an annual health review. There isn't a specific code for MGUS annual health review, and for audits purposes I've just chosen the code annual health review 6AK. Useful if we can tick that and mention something, and it just a bit of information about highlighting the things to watch for and to look for with these patients. So just for an example of a patient who I know is on that MGUS register, if I go to the frequent but not shared care list this month, I know anyone who's on the MGUS register who hasn't had their 6 monthly bloods will be in this list. And if I find a patient and open them up, I get this LAS. So what we can see here is if I hover over the nurse template, it tells me COPD and MGUS, and it tells me that this person does need some blood tests. They're also just mentioning eligible shingles and the high Ventolin use. This is slightly different to the EMIS one. This is just looking for anyone more than 3 in the past year. If I double click the HCA template, I then get a template that shows all the processes that I think a healthcare assistant should be considering. So for our Healthy Lifestyles QAF this year, because she's on a COPD register, it's asking for alcohol and weight. Because she's got mild CKD, I just checked an EGFR of 70, it's asking us to check her ACR. It's telling us there's a blood pressure, she's under whatever age the cutoff is, so her actual target's 140 over 90. Links to the blood pressure guidance if anybody wants them. And then this is the bit that's important for the MGUS demonstration. It's saying 6 monthly UNE for blood count calcium. She's obviously on thyroxine, so it's just saying if you're doing blood tests, please do thyroid at the same time. That's the power of pulling everything in the same place. And then immunoglobulin and electrophoresis. Now, if I look at this patient again and I can see which month they're born in, and I come back to the register for June, I know this patient will be in this nurse recall section, and I'll open up the nurse template. So again, I'm hovering over the nurse template, COPD and MGUS. I'll double click on that. And you'll see this is a slightly bigger template because I'm not including a lot of these processes in the HCA template. I want to try and keep that simple for them. But the nurse template shows everything. So it'll show if they're eligible, for example, for shingles. It's got the links, the Wales COPD guidelines, COPD HAP app, and the information for review, mentioning the whole more than 4 Ventolin a year, tells you how many antibiotics, and then here you can see MGUS, and this way you might want to tap to say no symptoms identified from the list below, or whatever you want to put. And then I think we've got a systematic, structured approach to make sure that we're inviting these patients in 6 monthly as asked for in the LES, and we're also making sure they're seeing the nurse at least once a year and hopefully ticking that box. And then when it comes to the yearly audit, which I can't show here because it has patient identifiable information, what I know is that I've got a structured process for inviting people in, for chasing up non-responders and for annual reviews. And I guess it's a straight 250 quid just for setting up this audit, and then it's £130 per patient per year. And I guess from an admin point of view, what you want is that the invites are just being done routinely, that you know that when they come in they're getting the test they should have. And it's just a quick example of how the MGUS works, but that is the same principle for almost every other enhanced service or blood test or process that the search is looking for.